Hi everyone, this is Dr. Hall, and so we're going to move into the urinary system now. We just finished the digestive system, which is the system by which we bring nutrients into our bodies, and we absorb most of what we eat, and then some of it we need to get rid of later on. So what we don't absorb from the digestive system, we do eliminate as waste out the rectum and anus, but there are things that we absorb that we then later want to get rid of for various reasons, as well as waste products that are generated by our own body systems that we also want to eliminate. So that is going to bring us to the urinary system. In the first part of this lecture, we're going to talk about the anatomy and the components of the system. In the second half, we'll talk about the components in urine itself, as well as an introduction to the nephron, which is the functional unit of the kidney. So a brief overview of our urinary system organs. We have two kidneys, one on each side, shaped like kidney beans. Beans are named for the kidneys. Then we have ureters, which are these tubes that lead down into the urinary bladder. We have a sphincter muscle that helps control the flow of urine, and the urethra is a tube that leads from the bladder outside of our body. So let's talk a bit more in depth about the kidneys. So Kathy wants to donate a kidney to her sister because her sister's kidneys have failed and she needs a transplant. But as part of their workup testing on Kathy, they find out she only has one kidney. And so this image is not actually an ultrasound, it's either a CT or an MRI. So we have a slice here, a coronal section, and we can see here is her left kidney here, and you can see the blood vessels bringing blood to and from the kidney. And we don't see a kidney over on the right side. We can see the liver here, which looks a little bit different from what you're usually seeing because this is just a part of a three-dimensional slice. We can see the abdominal aorta and our common iliac arteries. We can see the spleen and part of the pancreas. So pretty cool to see all of these images here. But Kathy only has one kidney, so is that a problem? Let's talk about it. So a few basic terminology things here. So renal just means of the kidney, and our kidneys are paired, usually we have two, located just under the lower back ribs, so your most inferior and posterior ribs, which is why punching someone in that area in boxing is illegal, right? Kidney punches, you're not supposed to do those. And the blood vessels then that bring blood to and fro are going to be called the renal artery, which comes right off the abdominal aorta to each kidney, and the renal veins, which drain, of course, into the inferior vena cava. If we cut open a kidney, it has a really interesting structure. So first of all, there is this outermost rind of the kidney. It's kind of like the rind in a watermelon, that white part, right? So this outermost section of the kidney is called the cortex. That seems counterintuitive. Often when I think of cortex, I think of something close to the center, but in anatomy, a cortex is an outer rind of material. So that's the cortex. Then we have the medulla, which is the middle part of the kidney here, this kind of middle layer, the meat of the watermelon, if you will. And the interesting thing about the renal medulla is that it has these pyramidal, triangular, candy corn-like structures called the renal pyramids. Those renal pyramids are part of the structures that produce urine, which will then drain into these tubes called calyces, and then eventually into the middle of the kidney, into this area here called the renal pelvis. So that's the area that collects the urine. So the kidney's main job is their excretory function, where they filter the blood and pull out wastes and other things that we don't want, and they get rid of it in urine. So they filter the blood and produce urine. There are some other important jobs of the kidney that we'll discuss in the third lecture. So Kathy only has one. About 1 in 500 people, or 0.2% of the population, naturally will just have one kidney. Most people don't know it if they've never had some special testing to take a look, and they live just fine. You can usually get by on just one kidney, right? Somebody who receives a transplant, they receive one kidney because the donor can only spare one, right? And so both the donor and the recipient can actually live on one kidney, usually quite well, as long as they take good care of it. So let's move on next into the ureters. So Peter all of a sudden develops terrible left-sided flank pain in this area here. So crampy pain. He goes to the emergency room because it's severe pain and is told he has a kidney stone that is stuck in his ureter. So it's like, what is a ureter? So as we mentioned, there are these paired tubes, one on each side, that are going to bring urine from the renal pelvis down all the way into the urinary bladder. Because the kidneys, right, they're up near your rib cage, and then your bladder is way down in your pelvis. So the ureters are pretty long. And the cool thing about them is that they have smooth muscle in their walls, and they actually peristalse urine down into the bladder. So even if you were to spend all of your day upside down for some reason, your kidneys would not fill up with urine because the ureters would continue to peristalse it down into your bladder, and then there is a valve that prevents it from flowing backwards up into the ureters again in most people. This video link is from a surgery, and you can actually see a ureter peristalsing urine through. It's actually of a dog, but ours works the same way. It's pretty neat. So in Peter's case, he has a stone that formed in the kidney. So just like you can have gallstones, you can get kidney stones as well with certain electrolytes or other substances get very high in concentration. They can precipitate out. And then that kidney stone would have been okay sitting up here in the pelvis, but as the urine starts to move down into this skinny little ureter, it can easily get stuck. And kidney stones, interestingly, often have this kind of spiky form to them. As you can see, that would definitely predispose to having them get stuck and also having them be very painful. So as the ureter tries to peristalse, right, you will get these waves of pain. So that's why you get that crampy, intermittent pain of a kidney stone. So this does need to get treated. Sometimes people's systems will be able to flush these through eventually on their own. Sometimes they need help in terms of some IV fluids or special medications, or sometimes lithotripsy, which is using shockwave therapy, or even kind of going up with a fiber optic camera into the bladder and up into the ureter and actually pulling the stone out for folks. Because if this persists for a long period of time and you have a blockage here, then urine can build up in the kidney and cause kidney damage. All right, let's move down into the bladder. So Bonnie has developed some really uncomfortable symptoms. She feels like she has to pee every 15 minutes, just really frequently. She also feels like she has to go right away. She can't hold it. We call that urgency. And she has this burning pain in her lower abdomen, in her pelvis, and on the way out, right? So it almost feels like she's peeing glass or hot peppers, and that is dysuria. So she goes to the health center, and it turns out she has a bladder infection. So what is the bladder? It is a muscular bag that holds and stores urine. It will gradually fill up with urine. Your kidneys are constantly making it all day, all night. And the bladder will eventually fill up. And then once it gets filled, you have smooth muscle, which, as you know, is involuntary, which will then contract to push the urine out. Now, smooth muscle is involuntary, but thankfully we have a sphincter muscle that surrounds the urethra here that allows us to control whether or not we actually urinate. So the sphincter muscle in this case is under voluntary control. This is different from the sphincter muscles we learned about in the stomach, like the lower esophageal sphincter and the pyloric sphincter. Those are not under conscious control. Those are involuntary. Thankfully, the external urinary sphincter is under conscious or voluntary control, most of the time anyway, but that actually takes a lot of time for us to develop. That's why infants and toddlers need to wear diapers. It takes years to develop control over those sphincter muscles. So the inside of the bladder is really interesting looking, and you can take a look by using a cystoscope pictured here, which then has a fiber optic camera and a light at the end of a flexible tube, which you can insert through the urethra and go up into the bladder and look around. So this link is a video of a cystoscopy, so you can see what the inside of a bladder looks like. It's pretty cool. This particular individual doesn't have a perfectly healthy bladder. They have an enlarged prostate and some other things, but still it's really neat to see. So the process of urination is called voiding or micturition. So if you see those words, they are referring to that process of urination by which that smooth muscle in the bladder wall contracts and pushes down. And if you relax your sphincter muscle, right, and open it up, then the urine will move down into the urethra. So what was happening with Bonnie? Why was she having frequency and urgency? So when you have a bacterial infection inside your urinary tract, particularly your bladder is irritated and raw and inflamed. So you can see in this image here, right, you can see how the inside of the bladder is all red and raw. It almost looks like a skinned knee, right? So it's sore and it doesn't want to hold urine. It's irritated. So it wants to empty as soon as it fills up with almost anything, and it wants to empty right away. So that's why you get that frequency and the urgency. And then when the muscle contracts, right, it's sore, so it hurts when you urinate, and sometimes the urethra is also infected, and so that can hurt as well. We can see here two cystoscopic images of the insides of people's bladder. So this is looking at the internal wall of the bladder, and this would be normal here. And you can see in this person very inflamed. So someone with a really bad infection, this is what the inside of their bladder would look like. So you can imagine, yes, this would be very uncomfortable. So since they're really common, especially in female-bodied people, I wanted to take a moment to talk about how we treat bladder infections. So these are caused by bacteria. They are bacterial infections, and so the treatment is to take an antibiotic. Usually just 3 or 5 days worth of antibiotic can completely knock these out of the park, which is great. There are other over-the-counter and kind of home remedies that people talk about, so I wanted to address those. There is an over-the-counter medicine called Azo and Urostat and other over-the-counter medicines that treat the symptoms of a UTI. And the way they work is they actually numb the inside of the bladder. So they help you feel better, but they don't actually treat the problem. This doesn't mean that you can't use them. They can be a useful adjunct, right? They can be helpful, but just keep in mind it's not necessarily treating the underlying problem. So you may still need antibiotics, even if it feels better with the Azo. So a lot of people will drink cranberry juice when they have a bladder infection or a UTI. The problem is that the data shows they don't do anything to treat infection. So once you have a urinary tract infection, there is nothing about cranberry that will help you. If you're prone to getting them repeatedly, taking cranberry can prevent infection. So it is effective at help preventing them from occurring. But once you have one, you don't need to drink cranberry juice unless you like cranberry juice. But if you don't need to drink it. It's not going to help any more than just drinking water or some other beverage that you enjoy. So in general, if you're drinking lots of fluids, that kind of flushes the system out, right? You're peeing more, you're kind of washing out the bladder. So often we'll recommend that to people when they have a bladder infection or UTI. But again, a lot of times, and most of the time, people are going to require antibiotics. Sometimes you can get a bladder infection gone just by flushing the system out, but not always. Oh, hi, kitty. So let's talk now about the urethra. Hi there. So urethra. Urethra wonders why it is that women tend to get bladder infections so much more frequently than men, and in fact they do. Most women will get at least one urinary tract infection in their lifetime, and many women will get more than one. And the reason is because of the differences in their urethras. So if we take a look at the urinary and reproductive anatomy of the male versus the female, right? So this urethra is a tube that leads from up here at the end of the urinary bladder all the way down and out the body. So in a male-bodied person, it has to travel through the entire length of the penis. So it ends up being about 20 centimeters long on average. In female-bodied people, it's just a quick hop, skip, and a jump for that urine to get out through the urethra. The urethra is only about 4 centimeters long. You don't have a penis to travel through, right? Just right to the vulva there. Here's a side view again, so you can see kind of the similar thing. Here's your urinary bladder. Here is the urethra here. Very short, only about 4 centimeters. It is also located very close to the vagina and the anus, relatively speaking. So when we look at the urethral meatus or urethral orifice, that opening of the urethra to the outside of the body, in male-bodied people, it's at the tip of the penis, which is well away from the anus. It's well away from, kind of parts of our body that are sweatier. But in female-bodied people, the opening to the urethra, the external urethral orifice, is right here. So it's very close to the vagina, which has lots of bacteria in it normally. It's also relatively close to the anus, which would be here, and it's in a part of the body that's subject to a lot of rubbing and friction. So it's easy for bacteria to get kind of pushed into that external urethral orifice. So again, we can see from the side view here that it would not be difficult for bacteria, which are plentiful in this part of the body just normally, naturally. I know it's not pleasant to think about, but that's just reality. It's easy for them to accidentally, especially with sexual activity or other types of rubbing, to get pushed up a little bit into the urethra. And from there, it's a quick hop, skip, and a jump into the bladder. So it's really easy for bacteria, because they're plentiful in the region of the urethral opening in female-bodied people, to then get up into the urethra. And then from there, it's a short trip to the bladder, which is paradise for bacteria. So they multiply rapidly and they cause an infection. So if they just infect the urethra, we call it a urethritis, but in female-bodied people, they'll almost always make it also up to the bladder and cause a cystitis. Very rarely, they can also move up the ureters and into the kidneys and cause an upper urinary tract infection called a pyelonephritis, an infection of the kidney. This is a pretty serious infection. It often needs long-term treatment with antibiotics. People can get very sick. They sometimes need to be in the hospital with that. So we take UTIs or urinary tract infections pretty seriously, because we know they can occasionally get severe. All right, what about URI? So what happens with men's urethras? Well, they don't tend to get urinary tract infections from general run-of-the-mill bacteria like female-bodied people do quite as often. It does occasionally happen, but it's less frequent. But let's talk about URI, because he developed some problems with his. So he's been having a lot of unprotected sex. So I think you can see where this is going. Now he has pus dripping out of the tip of his penis, and it burns when he pees. So this is a urethritis, an infection or inflammation specifically of the urethra. So the entire length of the urethra here is inflamed and looks kind of like the inside of those pictures of the inside of the bladder that you saw. This is most commonly caused by sexually transmitted infections such as chlamydia is the big one that we see on campus, and also gonorrhea can cause this as well. Sometimes just run-of-the-mill bad luck bacteria can also cause this. Sometimes I've also seen irritants like soap. Sometimes if people are overly aggressive with cleansing of their genitals, if you get soap inside the urethra, that can also cause problems. But certainly STIs are the most common cause of urethritis in male-bodied people. So to conclude our section on the anatomy, we have our kidneys here up at the top, divided into the outer cortex, middle medulla with its pyramids, and then the inner renal pelvis. Urine then constantly is peristalsed down through the ureters into the urinary bladder, which eventually fills up, and then the smooth muscle in the urinary bladder contracts to push the urine out. We relax the sphincter to allow that to happen, and urine moves out through the urethra. So part B will be talking about what is in urine and an introduction to the functional unit of the kidney, the nephron, which produces urine.